Assalamu alaikum wa rahmatullahi wa barakatuh. Ladies and gentlemen, welcome to the new episode of the MedAccess podcast. Today, I'm really thrilled to introduce my guest, Dr. Zakieh Abuelkhair. I've known Zakieh for a couple of years now, and she has taken, I would say, the risk to show up as my second guest onto this podcast. Zakieh as well gives me hope that the next generation has the right leadership skills, the right thought process, and the right innovation for our patients for better access for their medications. So today, since I have Zakieh, and she'll be introducing herself much better than I will, we'll discuss Zakieh's role in her current operation scheme and how did she improve medication access throughout her career. Welcome, Zakieh.
Thank you, Adel. I'm excited to be here and to share a bit of my journey. Thank you for having me.
That's great, Zakieh. Can you, I said I know you. However, our guests would love to hear more about Zakieh, about how did you enter pharmacy school? Walk us through your journey, since you started with pharmacy school up to now.
Sure. So I graduated with a bachelor's degree in pharmacy from University of Sharjah. And post-graduation, I joined a pharmaceutical company as a disease education specialist. I gained a lot of amazing skills, specifically in communication skills. It really built up my confidence entering the pharmacy market. Post that, I did my 6 months internship at Cleveland Clinic, where I had exposure to different rotations and different experiences in the pharmacy world. Post that, I decided to do my master's degree in University of Pittsburgh. It was mainly in pharmacy business administration, but they had different focus tracks, and I chose to be specialized in specialty pharmacy. And along with doing my master's degree, I also joined Al-Thiqa Pharmacy as a pharmacist. And post that, I was the pharmacy operations manager after a couple of years. And here I am now. So I'm excited.
That's great.
To be here.
Just commenting on the master's degree that Zakieh has obtained, I honestly was not aware of such a, I would say, subspecialty of a master's degree. And I hope Zakieh, inshallah, in the comments can help if you guys are interested in knowing or pursuing the same masters as well. I'm sure Zakieh will support you in linking you towards the right channels.
Definitely.
Now, let me start with your role, and just to keep everyone on the same page, Zakieh is currently the operations manager of a retail chain called Al-Thiqa Pharmacy, based mainly in Abu Dhabi, in the United Arab Emirates. Since we're talking about medication access, I'll start with her role as an operational manager with her employees and how she has done her role in upskilling her colleagues within these chains to improve medication access. For example, I'm sure every one of us, whenever you walk into a pharmacy and you've been struggling to find a medication, how did your team sort of overcome this relationship with the patient? Can you talk to us more about your operational manager role, specifically with regards to improving access to patients?
Sure. So first of all, training is a really important factor in improving medication access. What I mean by that is we have twice a week monthly sessions on a monthly basis. And we really empower our pharmacists to make very well-informed decisions, and specifically in critical situations like out-of-stock situations. So this is a very common thing that happens in retail chains of pharmacies, and it's really important to really guide the patient on a step-by-step basis on what alternatives could be offered to the patient, instead of just saying to the patient, well, sorry, sir, we don't have this medication, and we will let you know if it comes back anytime soon.
So as you were saying, you want the pharmacist to be more engaged, especially in retail settings, and that's the value add, Zakieh, that we really need to pass to our audience is I want the pharmacist's role in the retail setting to be effective. And you were trying to say, with that effective conversation with the patient, how did that help? Can you explain further?
It's really helped in two different ways. First of all, patients coming back to us, knowing that we will always provide them with an alternative because they really were happy with the first time since, medication was out of stock and then came back to us. This is what really differentiates one pharmacy from another. If the patient came into the pharmacy and asked the pharmacist, do you have this medication? And the pharmacist clearly just says no, and then the patient leaves. There is no added value, right? And there is nothing that differentiates you from any other retail pharmacy. So what we're trying to do is really to encourage our pharmacists to have an open conversation with the patient and to really understand what are they suffering from. So learn more about their condition. Is there something that they can offer at the chain without maybe getting back to the doctor? If it requires for us to go back to the doctor, we would definitely refer the patient to consult with their physician and inform them that this type of medication is currently out of the out of stock, and if there's an alternative medication that can be given. But we definitely start within the pharmacy setting if something else can be given. And this really built trust between the pharmacist and the patient, because now in his mind, he would know that every time I go to this pharmacy, I know that I have trusted pharmacists there and trusted healthcare professionals that can really provide me with an answer, with an alternative to a medication that has been out of stock, and I do not really have to suffer for like a week or two until this medication comes back in the market.
And that's what we need to emphasize about here, Zakieh, is the fact of the pharmacist in the retail setting stepping out of just the zone of a dispenser.
Definitely, yes.
which we respect and we value. And I just want to echo that piece is by the upskilling of each other, okay, we came to know certain techniques that we can actually assist the patient with solutions. And of course, as Zakieh mentioned, there are certain scenarios where it is within our bandwidth in the regulations to provide those alternatives. And when those alternatives are not within our bandwidth and require a physician intervention, either we give the physician a call and he needs to rewrite the prescription with the alternatives available, or we channel back the patient to the closest physician to write that alternative, and then they come back to you to dispense. So to me, as a supply chain expert, and Zakieh as an operational manager for her retail group of pharmacies, we closed the loop for the patient. Because at the end of the day, the patient can get the right treatment with the physician, right setting as a hospital setting, right x-ray, right equipment. He has done the right blood work, but at the end of the day, the treatment itself is not available. And just by the intervention, and that's what Zakieh is trying to emphasize on, just by the intervention of just that open conversation with the patient, we were able to solve the problem and increase access to the medication.
Exactly. That's like one of the main training points that I really try to include in our training sessions. Actually, pharmacists in our pharmacies, they're not allowed to say the word out of stock. It is a part of our culture, part of something that, every time a patient comes in, directly ask, what are you suffering from, sir? How can I help you? So that really, even in research, it shows that, patients who get pharmacist counseling, not only medication to access to medication, but access to medication adherence too. So they get more adherent to their medications, because at the end of the day, when the patient goes to the physician, they have some limited time. But talking about the case in general, they don't really dig into about the medication, how does it work, the side effects, what happens if you miss a dose. So all of these important information that should be included during the pharmacist counseling.
That's honestly amazing. That's emphasizing upon the role of training and the value of training and the weight that it adds to the value of the pharmacist, and upskilling them on top of their licenses. So leaving that side apart or closing that chapter about upskilling and training within your outlets, which I congratulate you for achieving that, and sustaining that is very important as well. Talk to me. So for the audience that's watching us, Al Thiqa pharmacies are known to the public by having 3 or 4 different unique initiatives to increasing access. One of them, when the pandemic hit, COVID-19, Al Thiqa pharmacies were one of the pioneers to provide vaccination to public, correct?
Yes, that's true.
Which is also part of increasing access to patients, because I don't have to always just go to the closest hospital. And at the time, patients were not that comfortable going to a healthcare setting. Everyone was like, quote unquote, freaking out.
That's true.
So talk to me about how did this conversation start at your chain, and walk us through the steps, and where is it now, and what did you achieve?
Sure. So if I remember correctly, it was on February 2022 where the Department of Health came and approached different pharmacy chains to ask them if they're interested to join their vaccination program. And to be honest, we were one of the first ones to raise our hands, because regardless of knowing, what are we expecting from this vaccination campaign or this vaccination, what do they call it, program, we really thought, we have all been waiting for this from a very long time. Vaccinations done by pharmacists has been, a while in different parts of the world, and it has been a successful initiative. Exactly. So it came with a lot of challenges. I'm not going to say it was easy. There was 2-week heavy training done for the pharmacist from a qualified accredited institute. And post that, pharmacists, they had to do some practical training. They had to be signed off by a nurse trying out the vaccine on 10 different patients. If they were successful by that, they would be certified. In addition to that, there were so many other certifications they had to take, like BLS, emergency CPR, knowing how to administer an EpiPen in case any allergic reaction happens.
Okay.
So all of these new skills have been added to the pharmacist, not only just, administering the vaccine. They would know how to really choose, really decide if the patient was eligible to get the vaccine or not, because there are some eligibility criteria that you have to look at.
So February 2022, you said, what, we'll be part of this. Then you let your pharmacists enroll into these training sessions. Then they got certified. They were equipped with the right knowledge with BLS and emergency situations. Then what happened? You started your campaigns, and how successful was it? On top of your head, do you know how many patients were vaccinated through your outlets?
Yes.
On average, I mean.
Yeah, sure. So we had them in 3 different pharmacies just to make sure that we have enough coverage in different areas. And to be honest, I did not make it something that was optional, but it was mandatory for all pharmacists to be enrolled in this. And I had 2 of my pharmacists who are afraid of, injecting, using the needles. So almost 98% of our pharmacists are trained to be pharmacist vaccinators, which is something that I'm very proud of.
I'm sure they're grateful, and I'm actually, again, giving Zakieh more work to do. I'm sure she can also share with you, if you're interested to become certified in providing vaccines to the public. I'm sure information is available online, but I'm sure as soon as we publish this episode, Zakieh will be more than happy to share the details.
Yes, definitely.
So 98%, that's a great achievement.
Yeah, so post that, creating the space, we had to create a space within the pharmacy. It was a bit challenging because, you need to separate some wall units off, and that's really challenging for a retail chain. As you know, in retail settings, every square meter costs you, right?
Yeah.
So, but really, we thought that this is part of our public health
Sort of a social responsibility.
Exactly, corporate social responsibility, and we really wanted to be part of the public health awareness campaigns that the Department of Health does. So we had actually great feedback from patients. Just because it was really accessible to them, anytime, because we have one of our pharmacies is the 24/7 hour pharmacy. We had patients come in at 3 a.m. and they wanted to take a vaccine. The patient did not have to take off from their duty timings to go and wait in line and take the vaccine.
So the convenience it added to the public is amazing. So you did not only increase access, but also the convenience. Like a patient who was thinking twice to take the vaccination and then sees the signboard as they cross through your pharmacy and say, we provide vaccination. You go like, you know what? I've read about this online, and you know what? Let's go get vaccinated. So that's great.
Yeah. So whenever it was initially, it was only COVID vaccine, and then when we had seasonal flu vaccines, we were included by the Department of Health to get the vaccines from them and then administer them to the patients. So it was also like a conversation added to whenever patients come in and they have like flu medications, we would recommend them to be
vaccinated against influenza.
Exactly. So that's, to be honest, it added a lot of because there's a lot of steps in taking a vaccine. Whether it was registering the patient, making sure the patient is eligible, to check if he had taken the vaccine before when was his last dose. There's a lot of documentation to be done.
So there's a due diligence checklist to be done by your pharmacist before actually administer the vaccine.
Yes, so it added a lot on their plate, but it really added a lot of skills to their usual pharmacy responsibilities. So I think this is something that they'd be taking on, not just for vaccination, but on to other initiatives if you're willing to include in the future, because it encompassed everything. So
that's great. And I know our podcast, guys, is talking mainly about improving access, and in this case we're improving access to both COVID and flu vaccines, seasonal flu vaccines, which by default increases the immunization rate across a city, which by default means lesser sicker patients, lesser sick calls at your work environments, so on and so forth. But this important piece, let me move away from access and always remind pharmacists who are always asking what's new in pharmacy. You can become certified become a certified vaccination. That's new. You can become a supply chain specialist. There's so many different areas now that you can specialize in that can make you work on top of your skills, your current skills, whether they are just being a normal licensed pharmacist or not.
To be honest, especially for pharmacists who have given up on the profession. I mean, never give up. There's always new opportunities coming in. There's always, things are changing, and there's a lot of different opportunities for pharmacists to be involved in. It's not just necessarily a community pharmacist, hospital pharmacist. As you said, there's supply chain. There's we'll talk about digital therapeutics in a while, and there's a lot of coming up, interesting opportunities for pharmacists to get in. So
that's great. I mean, honestly, back to access, I think you've done a great job. I think
Thank you.
That is something that, as you said in the beginning, was already being done worldwide, and I think doing this does help increase the immunization rate across the Emirate of Abu Dhabi and specifically in the UAE, and it has a very positive impact. Now, to the second initiative that Al-Thiqa Pharmacy adopts, and you spoke to me offline about this, and you also mentioned that I think you said your masters are also around specialty drugs, and talk to us more about how do you manage, and why especially did you focus on specialty drugs and the impact of their access to patients?
Sure. So just to begin with, let's define what specialty pharmacy is. So it's also a concept that has been established in the U.S. and Canada only, and we are trying to bring this concept here to the UAE because we really found that there's a gap, especially in managing specialty drugs from an outpatient setting. So a specialty pharmacy is a pharmacy that focuses on specialty medications and providing services like, medication adherence, financial assistance, making sure that there are monitoring of healthcare outcomes. So it's a full process. You manage the patient's journey from the moment he takes a prescription from the physician till his next refill. As you know, when you go to a hospital or to an outpatient clinic or a medical center and you take a prescription from the physician, whether it was a specialty drug or not, usually the next communication you have with your physician is your next refill, right? Mm-hmm. So specifically in specialty medications, there's usually a gap of communication where we feel that it needs to be filled. This filling can be done by pharmacists because I feel like they are very qualified in that. The cycle will be closed, and we would understand why did the patient drop out the medication. Is there anything that we can help in terms of alleviating the side effects? Is there anything else that we can trying to communicate with the physician to see if there's an alternative to the patient? Is he having any financial burden on him where he stopped the medication and cannot, continue with the treatment? That also can be fulfilled.
Mentioning the financial piece, Zakieh, and it's important. As we are aware, most of the patients here are insured.
Yes.
Specialty drugs usually come with prerequisites from insurance.
Yes.
And that itself is part of which we do respect, and we do acknowledge that insurance should not just approve a drug without knowing the history of the patient, whether in his condition, did the physician adopt to the first line of treatment before jumping into a certain specialty drug. But what I'm saying here is, again, around education that Zakieh is talking about, and again, the timeline required to achieve the access to the patient here, to make sure that it aligns with his next refill date, so that there's no, as they like to call it, or they call it, the gap of therapy. Mm-hmm. So talk to us more about the role of pharmacists in compiling those prerequisites, filing them to insurance to ensure that there's no delay mm-hmm. in either initiating these specialty drugs or even maintaining.
Sure. So before I get into that, I'd like to share a story, what really made me to get into specialty pharmacy. So I was an intern in one of the hospitals here, and I had a patient who I was checking in with his needs, and I wanted to see what he wanted for me to help him with. And he was asking for a prescription that he was taking for his rheumatoid arthritis. And I informed the patient that we need to take approval, and approval takes at least 48 to 72 hours, especially if it's a specialty drug. And the patient he finished his dose, and he was in so much pain, and it just really hit me. Like, I was very curious at that time. Like, why didn't anyone call the patient proactively to remind him that his refill is due at least a week before his dose finishes? Why should we leave the patient at a time where, rheumatoid arthritis is not a simple condition? It's a complex disease. So it really, hit me at that time. And I had a conversation with one of my mentors, and he told me, Zakieh, read more about specialty pharmacy. And that's where I'm like, wow, there's actually something out there that really focuses on specialty medications and patients that have complex diseases. So as you said, the process is very, it has a lot of steps in it, because when you take approval for a specialty medication, there is lab reports, there's a medical report, there's so many factors that need to be taken care of. So any new patient comes in with a new medical condition.
You need to set expectations that this is the time required and
Yes,
all
exactly. And we have like a database of all the requirements for each medication, prior authorization requirements. So it really eases the process for the pharmacist to make sure that,
prior to sending it, to make sure that, oh, I've sent it and then they've came back that no, this is missing or not. So you make sure, again, similar to the vaccination prerequisite list, now you have a specialty drug per disease prerequisite set of criteria for prior authorization or even for maintenance to make sure that these are met, and then the patient can safely go home and say, you know what, we'll follow up 48 hours and then we'll tell you, we'll keep you posted.
Exactly, because that's one of the burdens, right? That, you keep submitting for insurance, they tell you this is missing. So when you have something, set and just knowing exactly what are the requirements, it really increases the access to patients and decreasing the timeline of him or her receiving their medications.
And as you said, adherence and compliance will have a direct effect on the actual outcome of the patient.
100%.
So again, another area that you focused on, which is specialty drugs. Finally, before concluding this segment with Zakieh, I guess it's the era of digitalization.
Sure.
And again, I was speaking to Zakieh offline, and she talked to me about this new digital therapeutics adoption that their chain is going to adopt. And I think it's somewhere around insomnia.
Yes.
And increasing access to patients to the treatments of insomnia. So Zakieh, can you talk to us more about this app and what it does for our patients and its role in improving access?
Sure. So it's part of, as I told you, digital therapeutics. So it's a digital application that really helps patients in treating insomnia and also constructive sleep apnea.
So walk me through, like, first of all, so that our audience are on board with this. So the way I'm looking at this, you're increasing access by actually having a conversation with the patient, understanding his actual problem, utilizing technology through this digital app. Mm-hmm. So take me as a control patient or a dummy patient.
Yeah.
I walk into your pharmacy and I say, guys, I would like to enroll in this app. Mm-hmm. What are the next steps? And if I need to go see a physician, and like, what's the end-to-end process, just to allow our audience to understand more around the process of the application itself?
Sure. So the first step that we do is we identify the patient. So if a patient came in that has symptoms of anxiety, stress, or depression, that could be related to his insomnia problem. So that's part of the identification if it was a patient who's suffering from insomnia. The second, if a patient was suffering from sleep apnea, we would identify that. Usually it comes with patients who are diabetic, patients who have hypertension. So the first step is identifying the patients who are at risk of these two diseases. The second is we screen the patient. So there are some questionnaires in the application that can help identify if this patient is only suffering from chronic insomnia or is he suffering from sleep apnea. Okay, so for the third step, we would test or diagnose. So if it was a patient who is suffering from chronic obstructive sleep apnea, we would advise the patient to take an oximeter for 3 nights, 3 consecutive nights, and it would measure his oxygen desaturation index, which would then tell us if the patient is having insomnia and in which categorization. And if a patient was suffering from primary insomnia, we would analyze the digital diary. So digital diary, if he has slept, if he did not. So we would really measure the sleep efficiency. So that's part of the application that they have to fill up the diary. And then the last step, which is treat. So for treating primary insomnia, of course, there's medications. And plus there's the golden standard treatment for insomnia, which is CBTI, cognitive behavioral therapy. That comes in different 7 educational modules that the patient has to go through. And then for the sleep apnea, There is, as you know, the continuous air CPAP machine. So that is usually also directly connected to the application, so the patient would be
Monitored.
Yes, would be fully monitored. And of course, this is all, as this process, it's all connected to refer the patient to the sleep medicine specialists or physicians that are specialized in this area, so that they can have a consultation with a physician to ensure that they're on the right treatment plan.
So through these questionnaire and then the metrics of the oximeter, the generated report, after these steps, if the physician needs to see a patient to address the problem,
Yes.
he is channeled to seek advice from a medical practitioner.
Yes, yes.
Okay, that's great. So this is the role of digital therapeutics. Remind me again the name of the app?
It's called Sleep Up.
Sleep Up. And you said it's approved by the Department of Health.
Yes, it is.
It's great. At the end of this episode, I think I personally have learned a lot. I'm totally appreciative as a pharmacist now that actual pharmacists who are going to be watching this episode will be, first of all, proud that we have a young superstar in the making like Zakieh Abuelkhair. Honestly, yani. Second is, if you're complaining that pharmacy is, you don't have newer channels to approach, you've just learned now you have digital apps, you can become a certified in providing vaccinations to the public. We've also learned techniques around increasing access, whether through training, having that open conversation, how can you educate patients around medication shortages and solve their problems. And then we walk through how the importance of specialty drugs and how communication and early or proactive approaches reduce gaps of therapy, and finally digital therapeutics.
Yes.
Wallahi, Zakieh, I was glad to have you today
Thank you so
in the
much,
show,
Adel, for having me.
Really proud of you, and wish you more success. Thank you, Zakieh. Thank you very much.
Thank you so much.